Ketamine is a drug that has been used for sedation and for pain management, but recently research has found that ketamine can help with anxiety, depression, OCD, PTSD, and other mental health disorders. And so the way that ketamine works is that it creates new neural pathways in your brain. So you can think of it as your brain is always driving down the same road, and it keeps coming up to the same roadblock. And that roadblock is your anxiety, your depression, your PTSD. And so what ketamine does is it creates like a little side road or a little detour around your roadblock. So that's a little bit of the way that ketamine works in your brain to treat those mental health disorders. And so the recommended treatment at Ascend Ketamine Clinic is 6 IV infusions within 2 to 3 weeks. So you will come into the office and you'll go into your own individual room. You will be lying in a nice comfortable chair. We will give you noise canceling headphones that you can plug into your phone and listen to some music. It is recommended that you listen to instrumental music, something without vocals, just because your brain, once you're on ketamine, your brain tends to take you to what you're listening to. So calm instrumental music is recommended. Wear comfortable clothing. You can have, at the clinic, we have some blankets that you can put on if you'd like to. And then you'll have a pulse oximeter on your finger, you'll have a heart rate monitor, and Dr. Lane will start your IV. And so to get set up takes about 10-15 minutes. Then the IV drip takes about 40 minutes. And everyone will experience something different because you're dealing with people's brains. So everybody is different. For me, in my experience, I started to feel something within about 5-10 minutes. My body started to feel very, very heavy, and I felt like I was melting into the chair. And then you go into what is called the K-hole. And that is just wherever your brain takes you while you are on ketamine. Each of the 6 treatments, it was a different experience for me. My brain took me somewhere different each time. For some of it, I was in space. For some of it, I was in the ocean. For some of it, it was almost like kaleidoscope images. So it's going to be different for everybody. That is just my experience and how it worked for me. So about 40 minutes, and then maybe as you're coming out of it, 10 to 15 minutes as a recovery. You will need someone to come pick you up. You will not be able to drive home. After my treatments, I was very, very dizzy, and the dizziness wore off within about 1 to 2 hours. It's recommended not to eat within 4 hours of your treatment because it can make you nauseated. I felt nauseated mostly from the dizziness. I don't feel like I ever had an issue when I ate, but that is what is recommended, is to not eat 4 hours beforehand. And Dr. Lane, he's worked in the emergency room for over 25 years, has so much experience with this drug, and he is able to monitor you and monitor the effects and how ketamine is working for you, and he can help you with the dosage. It is recommended to be on the lowest dose that you can be on to still see effects. There is no research that a higher dose produces a more desired effect in recovery from your anxiety and your depression. So that's a little bit how ketamine works. There's about an 80% chance that this will help with your anxiety, your depression, your PTSD, your OCD. It's not going to take it away completely, but I was dealing with anxiety, and I have definitely seen an improvement. I think it's a great option if this is something that you're struggling with.